Georgetown University Center for Global Health and Impact, with funding and collaboration from the United States Center for Disease Control and Prevention, launched the Public Health Emergency Preparedness, Response and Recovery Fellowship. The initiative aims to enhance surge capacity and workforce development across West African countries in response to ongoing health challenges. Dr. Farah Hussein, a project officer of Assuring Public Health International and Domestic Security at the US CDC Nigeria Country Office, underscored the urgency of addressing health crises beyond COVID-19. Dr. Hussein stressed the importance of community capacity in emergency response and the critical role of a trained workforce in preventing localized outbreaks from escalating.
They say an emergency is determined by the capacity of the community where it occurs. There's an ongoing meningitis outbreak in the United States, but I assure you it won't have the same effects or impact as the current ongoing meningitis outbreak here in Nigeria and Niger. While many factors go into strengthening communities' capacity, having a trained workforce and a ready surge staff is one critical component in the country's ability to respond quickly and can be the difference in a small localized outbreak becoming a public health emergency.
Biringa Mercy Niyang, Senior Public Health Advisor and Deputy Residence Director of Georgetown University Center for Global Health Practice and Impact, emphasized the need to bridge gaps identified during the COVID-19 pandemic, particularly in engaging non-traditional emergency management professionals.
Following the needs assessment in September or August, one of the things that even happened during the meeting was even just learning about some of our cultural differences that have actually been an impediment for some of the cross-border challenges that we have, even as Nigerians with some of our colleagues across the border. But also it created a forum whereby we are able to transcend some of our diversities in either language or culture or practice and begin to put things in perspective so that when you now have challenges in Cotonou or Benin, they know who to call. There's a face, there's an understanding of the practice, there's an understanding of expectation. Today, we are hoping that we can move it a step forward to another set of people who are largely within either the hospitals, the ministries of health, who are traditionally not within the National Public Health Institutes or at the forefront of rapid response in the communities or at the Public Health Emergency Operations Centers, so that we actually have a complete linkage across the entire healthcare system. That way, we are better prepared, not just in one area, but across all the areas. However, I would say one of the things that these forums are actually providing is that we can actually share ideas of how to address for each of the unique situations and challenges that the countries have, and what seemed to have been impossible or totally unknown to some countries, they've learned it from other countries, and what other countries felt was impossible and only maybe possible in countries like Nigeria because of our population or how strong we are, they are beginning to realize that they can actually do the same and even do it in their own local way. So I would say that it's a small step, but we are making progress, and most of the leadership of the National Public Health Institutes, especially of even the participants that are here today, actually looking forward to the impact that these participants will go back with. So there is a lot of interest across board within the country at all levels.
The fellowship targets mid-career multi-sectoral public health professionals, equipping them with leadership competencies in emergency management. It focuses on engaging decision makers within ministries of health and associated agencies with a curriculum aligned with International Health Regulations 2005 pillars. The program offers flexible learning format and simulation exercises to enhance participants' skills in emergency management and health system strengthening.
What I have just seen few, I can tell you for a fact that this program is actually very dear to our hearts and is very important to us, especially we those in West Africa, because of the fact that, like I said, most of our staff on the ground are not well versed in public health emergency management. In fact, before, people thought public health management was a crop of people or personnel who were involved in it. But after COVID, we have realized that it needed all of us, right from those at the health, those at the education, at the local level. They are all supposed to be part of it. But indeed, we, the core staff who are here, we mostly lead the public health emergency management. For instance, in my home district, we have what we call a public health emergency response team, which is run by the district health directory, the district assembly, chaired by the chief executive. Then you, the district director, coordinates that activity. In fact, this committee has been there. We've been attending meetings and more or less like surface person until COVID happens. Then we realized that we were not actually prepared for the situation. So this program like this is definitely going to equip me with a lot of skills, and I will learn definitely from a lot of, my colleagues from the sub-regions. And when I go back, I will have a very Herculean task of making sure that first, my district health emergency committee at the district level are well equipped with these principles and whatever we're going to learn in managing situations like when an emergency strikes, as well as my colleagues.
Ongoing professional development through mentorship and a virtual community of practice fosters continuous learning and collaboration.
Ongoing outbreaks, multiple outbreaks, simultaneous outbreaks, and it's the same people who are responding, right? And we have limited resources. And when they respond, the programs that they leave behind are also impacted. So we want to develop a workforce that can be ready to serve as surge staff so that they can step in when their workforce is limited and that the health programs aren't impacted. We don't want to get response fatigue, and we want to make sure that if we have a workforce that's ready, we can be prepared, but we can also recover from emergencies very quickly. That's really the whole point. An emergency, when we have an outbreak, it will all depend on whether it becomes an emergency depending on how prepared we are. And so that's really what we're trying to do here is develop the workforce so that we're ready and we don't wear out the folks that are already at the front lines. We have people that can support them afterwards.
Expected outcomes include the development and testing of surge operations and workforce plans, enrollment in a knowledge-sharing network, and facilitation of regional collaboration efforts. The fellowship represents an innovative approach to health system strengthening and emergency preparedness in West Africa and beyond.